My name is Kathy Laferriere. I'm a nurse here at Lowell General. I've been a nurse for almost 29 years now, and I've worked specifically in the Go Red campaign now for the last 3 years. What I do here at Lowell General Hospital is that one day a week I'm the cardiac health educator, and I go out and I promote cardiac issues, mostly for women. I will do both, men and women. Go into businesses, and I do a brown bag series, and it's just it's a very informal luncheon that we do, and I just discuss what heart disease is, risk factors for heart disease, prevention and treatment of heart disease as well. To me, the Go Red campaign, it's a program of awareness. It's to get the word out that heart disease is the #1 killer of women. Most women are concerned about breast cancer, and this program that it's supported or ran by the American Heart Association, it makes women aware that heart disease is something that they should be concerned about, and along with awareness, there's a lot of education in prevention of heart disease as well. The reality is 1 in 8 women die of breast cancer, and 1 of 2 women will die of heart disease. Heart disease, it's an accumulation of plaque and cholesterol, so to say, building up in your arteries. Our arteries just have one thin wall of cells that protect us from this heart disease, but what happens over time is as we insult our body, meaning we smoke, we have high cholesterol, we have high blood pressure, all this insulting that we're throwing at our body reacts to it by actually an inflammation process that causes heart disease to build up. And then over time, as this disease is built up more and more, it starts causing symptoms of chest pain, or what we call angina. The classic warning signs for heart disease or for having a heart attack, everyone knows the elephant on the chest. There's a tightness, there's a heaviness, I can't breathe, profusely sweating. Those people are usually pretty good about getting themselves into the hospital. But the other side effects that aren't quite as obvious, and they seem to be more common with women, it's just something just doesn't feel right is what we hear a lot. Might just be an ache or a slight tightness in the chest, but it doesn't last. It's kind of stuttering, as we say, kind of comes and goes, or upper back pain, and they just don't associate it with the heart. Another common symptom that women get, instead of having it up in the chest, it's more lower chest and in the stomach, upper stomach area, and so they tend to think it's something that they ate. Any symptoms that last longer than 15 or 20 minutes, where they're not sure, some type of discomfort, like I said, upper stomach or chest, upper back, we call 911. Just call 911. Don't go to the hospital yourself, because you need the ALS people there, because they can start the process of getting everybody ready if this is a heart attack, and getting the emergency room ready, getting the cath lab ready if it is a heart attack, and so we can stop the heart attack in its tracks. What we ask people to do to prevent heart disease is one, we call it know your numbers. So know what your blood pressure is. We want everybody's blood pressure now to be 120/80 or less. If you already have high blood pressure and being treated, then a blood pressure in the 130s or over 80s is considered okay. Know what your cholesterol is. Your cholesterol should be less than 200. That being said, though, you need to know what the breakdown is. Everyone hears about the good cholesterol and the bad cholesterol, but you need to know what those numbers are as well. Exercise every day. 30 minutes every day is very, very important. If you smoke, you need to stop smoking. Again, smoking is the #1 preventable cause of death here in the United States. Actually, that's worldwide. And then diet, exercise and diet. Keep the weight down. If we didn't have all these weight issues here in the United States, I'm sure the issues of diabetes and cholesterol wouldn't be as an issue as it is today, either. If women in Lowell are looking for more information on women's heart health, they can go to the Lowell General website, and there's a lot of information there. There's a lot of programs that they can sign up that will help them support their heart health. We do cardiovascular screenings once a month in the Heart and Vascular Center. Those are $25, and it does a full cholesterol panel, as well as the body fat analysis, weight, BMI, and we check out circulation in the legs as well. So if people are interested in that, they can certainly sign up for that. And then if they're interested interested, they could sign up for the Go Red for Women movement. They can sign up that through the website as well. That's goredforwomen.org. And that will give them a lot of education. And I know people are always leery about signing up online, but I can tell you they only send information out a few times a year. And it's just a great resource on the newest things that are out there for women in heart disease and what they can do, as well as recipe and tips on how to stay heart healthy. So February 4th is National Go Red Day, and Lowell General is also supporting this program as well. So we encourage everyone that day to wear red, and it's just to let people know that you're in support of that heart disease is the #1 killer of women. We're still trying to get that information out there, and if people would like to sign up, they could also donate $5 to the American Heart Association for that cause.